Hey y'all, and welcome to my channel. On this page, I talk about technology, money, hockey, and sometimes trendy news. Welcome back if you're returning, and if this is your first time clicking on one of my videos, you're welcome here. For everyone listening, however your life, I hope everyone's life is going well right now, and that you're doing what you need to do to take care of yourself. Today, I wanted to talk about a really short article I came across earlier this week on how the role of nurses at a health system in the Midwest in implementing artificial intelligence and how it's being integrated into the electronic health record. And I will continue this conversation that I started about approximately a year and a half ago on this page, maybe 2 years now, on the increase that I am seeing, how artificial intelligence is impacting nursing practice and how registered nurses, no matter where you are practicing, how this technology is going to change and is changing how we practice, whether you're at the bedside, whether you work in outpatient, whether you work in an ambulatory care setting, whether you work in perioperative care. Artificial intelligence is changing how nurses practice. And I continue to talk about this because I see the news articles, I see the webinars, and I see different conversations happening and how it is impacting. If you all remember, maybe about a month and a half ago, I did two stories. One on how the registered nurses out in California were protesting artificial intelligence, and we're talking about how it's impacting their workflow operations at that health system. And then there were nurses out in Tennessee, maybe about 2 weeks later, that they weren't protesting AI at that. Those nurses weren't protesting AI in Tennessee. They were just calling for the ethical use of artificial intelligence, if I remember correctly. And I'll link to those two videos once I'm done with this. But what I wanted to do with this story that I came across with how nurses are being utilized at this health system out in Wisconsin is I want nurses for us to continue thinking about, as these implementations are maybe happening at health systems or hospitals that you aren't or we aren't working at, how it may be coming to the organization that you are. And just a few lessons that I'm just picking up on, even for myself. I'm a registered nurse. I've worked in tech for over 20 years, and I still think about how it's going to change my work, even though I work in a purely technical role now. So this story comes from Becker's, and as always, I'll be sure to leave a link to references in the description box so you all can go out and read the article for yourself. I always tell you guys, whatever I say on this channel or any YouTuber, TikToker, Instagram page, never believe what I say. Always be sure you're doing your own due diligence for any information you come across the internet. Okay, that's why I always like to make sure to give my references. So the title of this article is The Role of Nurses in UW Health's AI Messaging Pilot. So I did a little bit of research. UW Health is the University of Wisconsin, and it is a very large health system based in Madison, Wisconsin. They see approximately over 800,000 patients a year. And and they have 6 hospitals and over 90 outpatient clinics. So this is a large health system. And I also noticed that they have Epic as their main electronic health record. So this is a very large health system that is using generative AI and doing pilots to change patient care. But they're also utilizing nurses very heavily for this pilot. And I see some lessons here. So the article says nurses play a crucial role in shaping the use of AI-powered patient communications at this health system. So since April of last year, they have been working with Microsoft and Epic to integrate generative AI into clinical practice. So the generative AI specifically they're utilizing a large language model, and they have been using it to asynchronously draft messages responses to patient messages for providers. So asynchronous means it's not done in real time. But what I found interesting, this article is very short. So the technology generates the message and a human always edits it. If they don't like the message, they can modify or delete it. The key is the human that's editing the messages are registered nurses. So these are asynchronous messages generated by generative AI or a large language model, like from a physician's note or a physician's message that needs to be sent to a patient. But they're having registered nurses review these messages for tone, for accuracy, for relevance before the message is sent to the patient. So these are provider messages that the AI, that registered nurses are doing the review of. So they have providers that they said the number of UW health providers who have adopted the use of these messages have grown from 10 to more than 100. The pilot has resulted in the creation of more than 5,000 messages across 30 departments. And then they're just continuing to refine the messages, just like you do in a pilot, right? You continuously, before you implement wide scale, you see where you need to tweak the technology. They're saying they're observing how they can train the technology better. They're leveraging their data, their providers. And when they say providers, I'm assuming that's not just physicians, but that's also advanced practice providers, such as nurse practitioners and physician's assistants, and patient interactions in order to customize the responses with the preferred style of the organization. So they have not yet rolled it out to all of the clinics. They want to make sure that they are taking the time to do it right, since it's new technology. They want to give their staff time to adopt to the technology and also to train the technology, because with large language models and generative AI, the more good data that you feed into it, the better it gets. Okay, so like your LinkedIn feed is like an algorithm, or like your TikTok feed or Instagram or Twitter. The more you like, share, the algorithm gets to know you and it makes better suggestions. And generative AI in some cases work the same way. So it says to train nurses, it requires time. So you're still in time for people who don't have time. So they are involving nurses in every step of the process, and not just going live with it, but monitoring the utilization and the accuracy of the technology, because that's where the real responsibility lies. Like, to me, that speaks to the ethical piece of ensuring that they are ethically utilizing this data before they're making it widespread. But they said it may take, before they start rolling it out widespread, it may take months or even years, out of respect for nurses' time commitments. That is the article, very short. The lessons that this is interesting to me, because these are provider messages, but they are utilizing registered nurses to better train the AI, to make sure that the tone of the messages are appropriate, is accurate and relevant. So registered nurses, just like I've been talking about on this channel, especially nurses at the bedside, just to continue to make sure that you're thinking forward and thinking about what's coming. Because right now, like, these messages these are providers' messages, right? But they're using registered nurses and they're involving RNs to make the technology better. This is why I always say, for registered nurses who work at the bedside, I did a video on it a few weeks ago. I want bedside nurses to always remember that you had the inherent value of your clinical skills, your knowledge, your experience has immense value. I think I did a video. I think it said bedside nurses equals inherent value. But I always want registered nurses to remember that, especially the ones at the bedside, because I've been at the bedside and I know when you're in the thick of working at the bedside, dealing with the patients, following up with the providers, running down to the lab, running up to the blood bank, the patient's tray, the family members and all of that. I think it can be easy to forget, and just everything else. Maybe something's going on with staffing that day on your unit. I think it may be easy to forget how much value your experience, knowledge, and skills holds to not only the organization that you work at, but more importantly, to yourself. So number one, I want registered nurses to remember, always be encouraged. That's first of all, because I know it can get frustrating working at the bedside and dealing with everything that you may be dealing with. But when I see, and this technology that's being rolled out is still so new and is not as widespread yet. It hasn't been disseminated very widely yet, but I know there are multiple organizations doing multiple organizations similar to University of Wisconsin Health that are doing similar pilots and involving nurses. And the reason why I know that is I was on a webinar yesterday, and there were 3 different health systems from across the United States, not Wisconsin, but they are doing the same type of pilots where they are epic organizations having registered nurses reviewing the technology around these AI generated provider messages. So it's not widespread yet, but it's coming. So people may be working at organizations that may not be quite there yet, but I just want folks to just remember and prepare, because number 2, again, you always want to know that your skills, knowledge, experience holds weight and has immense value. So the organization you work at may not be where you land at forever. And I always want people to remember that you have options, right? I did a video a while ago that registered nurses should always remember that you have options and your skills and experience has value. That's number 2. Number 3. Number 3 is what you do is not who you are, not always, right? So you're a registered nurse is what you do, but that's not who you are. I hope that one makes sense. Maybe I'll go into that a little bit deeper in another video, because what I mean by that, sometimes I think as nurses, when you're not at work, you're not a nurse. You're still, you could be a wife, mom, fiance, auntie, uncle, etc. Right? So not to be so, not to let the stress of your work just have to bog you down, right? To make sure that you know that, yes, you're a registered nurse, but that's not who you are. Number 4, I would say, look at this as a growth opportunity, right? So when I read this article and the webinar that I was on yesterday and listening to these nurse leaders talking about how they're utilizing the nurses at their organization to make this technology better. If I was at an organization that had not yet implemented this technology or was just maybe not as technically advanced, I would see this type of how this is coming, right, as a growth opportunity, right? Or if I was in an organization that was implementing this technology and I was a registered nurse at the bedside, interested in getting more into informatics or getting into more of a technical role, volunteering and being on like a committee, being one of the registered nurses that is working and interacting with the generative AI and these large language models could be a growth opportunity to propel you to a different opportunity beyond the bedside. The only thing I questioned, because it's not mentioned in here, but as I was reading, I was like, I wonder if these registered nurses are being paid extra, right? That was just a question in my head, right? Because, maybe not, maybe they are. I don't know if they are, like if these registered nurses at the bedside, if they are hourly employees, and if they're doing these reviews of the generative AI, like if they're coming in on their off days, right? And like badging in and being paid for their expertise, right? Because this is, the very first sentence in this article is nurses play a crucial role in shaping the use of AI-powered patient communications, right? So if nurses are playing a crucial role in shaping the use of this large language model and doing the labor of reviewing these messages for tone, accuracy, and relevance, right? Because these are physician messages. Are these nurses equitably and equally being compensated for their labor? That was just a question in my head. But that's it, y'all. I want folks to take this opportunity to think about how this may impact, if you're a registered nurse, wherever you may work, how this may impact the work that you're doing. If you made it this far in the video and listening from the future, please do like and share the video. Liking and sharing the video does two things. Number one, it helps this information disseminate and get out to more people on YouTube and other platforms. And number two, it encourages me to keep creating content that you all find valuable. I hope everyone is doing well. I definitely hope you're taking care of yourself, and I'll see you in the next video.